Tell us about the health issues that led you to try medical marijuana.
Well, my health issues started way back when I was young, actually. I've had PTSD for many years. Grew up in a pretty bad situation. Thank God I lived through it. When marijuana started becoming more available, I started trying it and I realized that it did suppress a lot of those horrible feelings of fear. It helped me sleep better. It helped the horrible pains that I had in migraines that I already had suffered from. It helped with nausea whenever I would have the migraines, things like that. It just helped with so many different things that I was surprised. You know, that this wasn't just something, just some other thing that I was going to try. They had me on Lexapro, they had me on Effexor, Wellbutrin, Zyprexa, and lithium, which is by far one of the worst if you ask me. They tell you that this is going to work for you, you know, believe in this drug, and then the next thing you know, you're not even the same person anymore. And I found myself in that alternate state of reality where I need to do something. Something's not right. My doctor had me on 10, 12 different medications. I knew this wasn't good for my body. And then I had my brain trauma. A couple of years back I had a concussion, and when I had my brain trauma, boy, I wasn't myself at all. And the PTSD creeped back in really bad. And I had onsets of the panic disorder and things like that again, to where it was pretty well uncontrollable. So I finally found the right doctor who was listening, and he agreed that these medicines are horrible. They're horrible for your liver, your kidneys, everything, your respiration, everything, and including your brain. And my brain had had enough already. It didn't need anything else in there messing it up. I was amazed at the relief that I might be able to live again without the worry of, am I going to have a panic attack today? Should I keep myself limited to a 30-mile radius of the house in case I have a panic attack in the car? After 5 days of a migraine, during the day and at night while you're trying to sleep, while you're trying to shower, while you're trying to eat, it's impossible. You pretty well just would do anything to make it stop. Well, it's never going to be fine. I know this is something that I'm going to have to live with for the rest of my life. But at least this helps suppress the symptoms to the point to where I can live my life instead of living inside this box. I've come off almost all my medicines. I'm down to 2 now. And that is amazing. So,
is that just anxiety medicines, or which ones?
Yes, anxiety and pain are the 2 that I'm still dealing with the most. But we're hoping that since I just recently started this program, we're hoping to find the right strains to be able to go ahead and taper off of the others as well. I finally did get the card. I am finally able to start trying these strains. Let's see what happens next. And so far, I don't think my anxiety would have let me come here today. So it would have literally talked myself out of it, or it would have gotten to the point to where I would have had a panic attack and just decided, you know, I better not. It's better to just sit at home, better to just not be part of life, which is horrible. Nobody should have to live like that. Because even now that it's legal, you still get the looks, you know, from certain people. They will look at you like there's something wrong with you, or that you're some kind of drug addict. And that's not fair. That's exactly what you're not trying to be. You don't want to be a drug addict. You don't want to go to the streets to find whatever that you need, or that you're some high that you're trying to get. That's not it at all. So you're just wanting help and someone to listen. I'm glad you guys gave me a chance to talk.
Wonderful. Thank you very much.
Thank you.